So we already put up a video on the half kneeling press as part of daily practice. This one's specific for neck and shoulder pain, a little variation, and also a bit of a challenge only if you want to. And this is more theoretical than anything. I want to see how you do with it. I myself am going to do this for a week, so you can join me if you want. So that would be, as far as daily practice, doing this 3 to 4 times only on this left side. And there's going to be a little movie ad for the right. That's why I got Dose kettlebells. So we do want to. I'll talk about grip and everything in a second. I'll just show you the move and see if you want to do it. It does not have to be a half kneeling press. You could do it in a split stance. The reason we do it down here, I'll explain later. We'll explain why. There's a reason. Okay. Get a good angle here. So getting good grips. Wrapping in on both. The right, I'm just hanging for right now. Just helping me anchor my body down on the right. Pull on that right trap a little bit as I cycle through. Doesn't matter how many you want to do. Little hold, little shake at the top. So I'm thinking I want a nice stretch of the lat, and we'll talk about that in a second. I like that little tremble right there, pushing, trying to straighten out that elbow as much as I can. Get a big stretch down my back, down my left side. Right kettlebell is hovering in the air, just so you know. I feel the neck challenge. Going for about 10. I have lost count. I'll say about 3 more. One more. Breathe, brace, press. I'm going to bring the left one to rest on my shoulder. Turn here so I can see. I'm going to do some rows on the right. Rows on the right. I'm going to hinge. Now remember, I have this good hook grip. That's going to help me not let the elbow fully lock out. I don't want that shoulder rolling forward. We'll explain why. Hinging. About 10 rows. It might feel impossible here. We can try a stand. Nice and powerful stand. Let's talk about it. Let's get Billy over here. What is the madness? Why are we doing this? Hi, Billy. There we go. So, I mentioned the lat. That's a common thing I see on a lot of people is the left lat. We got iliac crest coming up the spine here. This is an area right where lat attaches. When I'm doing these presses, I will feel sometimes even some movement opening up in that thoracolumbar area. Lat runs all the way into your shoulder. So when it's tight on the left, it affects the shoulder and the hip. It's one of those big muscles that crosses like that. We'll see a right trap dominance with this pattern. What do I mean by dominance? It's hypertonic, it's tight. There's lots of knots here. It might feel tight and painful to you on the left. And a lot of what we're going to talk about here, you might think you're opposite. Well, there's one way to test it, baby. Do this and see if it helps. If I'm wrong after 3 days, you're kind of feeling worse, well, you know how to fix it. Just do the other side. This is a very common pattern, though. Shoulder, neck gets funky. Sometimes we'll have a pattern down here that won't relate normally to the neck, because the neck is compensated so much, and it's created new weird patterns going on. Come to your chiropractor. He'll give you the okay on this one. Well, probably me, because I'm the only one that studies muscles like this. Trap, very tight upper trap. So that kettlebell kind of helps put some tension on that trap. And the neck thinks, ooh, I got to hold and stabilize more. It's going to do less wonky things when you're getting the presses on the left side. Let's take it back to the hips here. Hip and shoulder, what I'll see as well. Again, you might not see, because on the left side, that one, will roll forward. So if we do that, you can see Billy automatically, he's already looking to the right. So what is Billy naturally going to do? He's going to push his right shoulder forward. And now he kind of looks even, right? He might even feel even. And you might look in the mirror, you're trying to feel like, is my right shoulder really forward? It looks like my left is forward. It might look like your left is forward because pelvis rotation, right? And you might think your pelvis is even because this compensates. And it's not so much that the shoulder and the hip compensate, it's the spine doing it. The spine is a great compensator. That's why we have so much out in the spine. It's because of these hip and shoulder issues. Address the hip and the shoulder, your neck will be happy. It just makes sense, right? These are little tiny bones in the neck. You think they're causing all the problem? The big players with the big muscles that all attach to these little bones. That's why they get out. I'm not saying don't correct the spine. It can help the problem. Sometimes they're just so stuck and they've been so stuck for so long, they need to be put back into place. But if we're not doing the hip and the shoulder, baby, you're not doing foundation training, what are you doing here? Like, seriously, what are you doing here? You're being non-compliant with care. There, I said it. And of course you're not going to get better. I'm tired of writing all my notes and being like, patient's the same, insurance calls me. Why are they not doing any better? Either I'm a terrible doctor or someone's not doing their job, right? I can't strengthen your muscles for you. If I could, I would. I would do it all day long, right? We got to address these patterns. So this is one way. So the row, we added that little row in, don't forget about it. That's simply, and it helps to visualize, draw that right shoulder back. That's why I don't want it going forward too much. So I'll show you that grip again. Because if I'm reaching down and I'm protracting the shoulder, that means go forward every time. And then retracting, that might not help. If I kind of really help keep it locked, so it's not going too forward, then I can focus more on the back, pulling it back. Same thing with the press. Fight for that top stretch. It shouldn't be the down, right? And it's hard to cave left and feed into that lat if you have that right-handed kettlebell locked in. So in some ways, this might be a better option than the half kneeling press I gave before. We had the arm up for stability. That's all good stuff too. But a kettlebell, also another good option. Then you got more weight. So it doesn't have to be super heavy. Like I had 70 total. That could be a lot for your body, right? But it really feeds decompression. The more weight you get on, your spine's go, oh, I'm gonna get tall. That's the quick 1,000-foot view there. Let's hit the exercise one more time. Really want you to see the grip. So I think I'll do it from the front this time. Get it from the front. Okay. All right, I'm doing the same. I'm doing this 4 or 5 times a day if I can. One set, just take a break. We're not burning ourselves out. It's not a workout, it's daily practice. I'm thinking of it more of like a quick soft tissue mobilization, a little bit of strength, like foundation training, get the best of both worlds. I want to show that grip. The grip going in, sometimes I even like chalk for this, just helps me grip better. It'll start to slip in my hand. So we can always chalk up, hook around. You'll notice, because your elbow you'll just feel a lot more up the chain. You'll feel your elbow doesn't do that. See the difference? It's very subtle. Let me see, there's a tiny little bend in my elbow versus when my wrist straightens out. And I feel it more, holding it more with my fingers, right? I'm not wrapped around the handle. I'm doing that with the left as well. I'd say that's less important. You can do a lot of different press variations, right? Even dumbbell, this is gonna work. It doesn't have to be a kettlebell. Just be able to wrap the dumbbell the same way. All right, let's hit it. But yeah, we could do palm press on the left. I don't care. on the left, as long as you're pressing overhead. There's different reasons why we would do different things there with the grip. But on the right, this is about the only option right here. I can feel, all right, it's getting greasy. Probably could use some shock, but we'll just do for now. Wrap in, maybe set that right up first. Lock in on the left. I'm getting tall. My weight is back a little bit here. I'm not in a hinge here. I'm straight up and down. Pressing, fighting for that full range of motion. One thing I forgot to mention with Mr. Skeleton is the lat responds well. It is an extender of your spine. We need a little flexion in the back, which I tried to show before. Just as an example, I don't want to, as soon as I press, my body wants to extend. Don't let it. Tighten the core, pop the chest. You'll feel your breath inflates your back. Then when I go up, I'll get a big lat stretch as I press overhead. Good. Out. Hold it over the shoulder. Let's turn this way this time. Of course, you don't have to turn. You don't have to do that. Get that good grip again. Feel active shoulder. I feel how I can't roll forward with this grip. Hinge. Load in that right hip. Rose. Bonus one, 11. Practice that get up while you're at it. That's a little bonus. I want to talk about that lat one more time. All right. Lat will hyperextend us. And some of us are living there, especially when we press, pelvis comes forward even more. So the kneeling, or the split stance, the kneeling more. A kneeling half lunge helps me keep the core tight, helps me not extend when I press, and I'll get a bigger lat stretch. Remember, there's a big component here. You need to stretch the lat. So focus that. Form before you press. Okay. In the row, same thing. We're in a hinge. That helps me not hyperextend by going to that hinge. Even when I row, my spine wants to help. Right? So I might feel like, oh, I can't get a good lot of motion. Like you see, my arm isn't moving a lot, but I'm targeting every time. I'm targeting that shoulder, and you'll feel it. I almost feel my right one and my left. Right? I know it's very odd for a lot of people. That doesn't mean you can't train and do everything else. Do everything else you're already doing. Let's just try this for a week. See how those neck and shoulder